The Philippine Nurses Association of Nevada now brings you Filipinars, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Well, good evening to you, Filipinars listeners and followers. Magandang gabi po sa inyong lahat. We hope you are all well. Well, as you know, this program is brought to you as a public service project of the PNANV, or the Philippine Nurses Association of Nevada, in collaboration with our favorite radio station, PHLV Radio. So thank you again for joining us today. We appreciate your continued support. Okay, before we get to our very interesting topic for today, I'd like to remind you of the PNA project called Give to Nurses campaign. And this project is in partnership with Massage Envy. This is given back to the nurse frontliners who have been caring for COVID patients. And this project is going to end on August 31st. So we still have a few hundred vouchers to give away, vouchers for 1 hour free massage or facials to the nurse frontliners. And all you have to do is go to our website at pnanv.org, look for the Give to Nurses campaign tab, fill out the information that's requested, and one of our board members will be vetting the authenticity of your application. So once the information is confirmed, you will be put on a list of winners for a free massage voucher. And the vouchers will be distributed to the winners after the campaign closes on August 31st. So you still have time. We have a lot to give away. And so please register to give or to get your free massage from Massage Envy. So thank you for all you do, nurse frontliners. Okay. Well, we have a very sensitive but a very relevant topic for discussion today, and it is racism and nursing. Racism has a very profound effect on the health status of people. The negative impact of racism on health and well-being through biases is very clear. And the profession that is right in the middle of this issue, and the profession who's providing health care to the people, are the nurses. So today we have invited two educators who are going to help us understand this very difficult issue. So please welcome Dean Angela Amar and Miss Minnie Wood. Welcome, ladies.
Thank you.
We're glad to be here.
Very happy to be here.
Thank you. I'll give a little intro of you guys, and you can add on. So anyway, Dean Angela Amar joined the UNLV School of Nursing as the dean in January of 2018. And Dean Amar dedicates her career to enhancing the diversity within nursing leadership and improving the care and support for the survivors of violence and trauma when they enter the healthcare system. Dean Amar is an American Academy of Nursing Fellow, an International Association of Forensic Nurses Distinguished Fellow, and a National League of Nursing for Nursing Academy for Nursing Education Fellow. And Dean Amar is also certified as a clinical nurse specialist in advanced practice, adult psychiatric and mental health, and an advanced forensic nurse. My goodness, you're busy. Welcome, Dean Amar. You have anything to add to that?
Thank you. No, that's good. Those introductions always make you blush a little bit, so that's enough.
Okay. And Miss Minnie Wood, she is master's, APRN, ANPDC. She is actually a lecturer and a clinical instructor in the undergraduate program at the School of Nursing. She earned her master's in nursing at the University of California, San Francisco, and is an ANCC certified adult nurse practitioner. Ms. Wood brings her passion for community health, my kind of gal, and working with the underserved populations to her students in the community health course. She also maintains a primary care practice downtown here in Las Vegas, right, Ms. Wood? Minnie?
Yes, that's right. Thank you so much.
Welcome. Anything to add to that?
I don't think so. I think we'll get there. There's a lot to
All
talk
right.
about.
Okay. So, yeah, this is a very sensitive subject for us. So let's get started with by defining racism. How do you define racism? And feel free to interject, both of you.
You want to start?
Want me to start?
Yeah.
All right, I'll start. So, so how do you define racism? So, one definition of racism, and I think it's a good one, is the oppression or marginalization of people of color based on socially constructed racial hierarchy that privileges white people. This idea demands that perpetuating racism requires power and control, right? So we're not just talking about, prejudicial remarks from individuals to other individuals, but about systems of oppression and marginalization that exist in our society. So that's what I've got.
Very good definition. Very complete. Good.
Amar, anything on you?
I think it's a very good definition. I agree.
Yes. Okay, so I recently looked at the Las Vegas Heels features, and I saw you both had articles on racism, why racism in nursing, and the education portion of it. So, can you tell us about your background and how you came to think about racism as an issue in nursing? Dinamar, you want to start?
I can. So, I think that I first sort of had to learn about racism just in this country as a whole. And so growing up as a Black person and growing up in the South, it's really easy. Race is very clear. People don't celebrate ethnicity as much because there's a really clear line about you're either white or you're Black, and it doesn't matter anything else in between. And those lines are built on the system of oppression that says that because of characteristics that you see in people, you discriminate against them. And so so I grew up always knowing, my parents were very good about educating me to know that wanting to make sure that I knew my worth and value, and that I knew that I came from a really strong family line with strong, solid people, but that everyone in society wouldn't see me that way. And so it became a thing of you have to work hard and you have to work extra hard because you're always going to have to prove yourself, and you're going to have people who doubt you and who you are because of that. Entering into nursing, it was real easy because most of my education has always been in predominantly white schools. And so I've always been one of few. And so same as in nursing school. And same as many of our institutions. So some of the same things that could happen at a society level are certainly nursing's a microcosm of that too. So any perceptions of superiority, inferiority are going to follow themselves into nursing. At every school that I've worked in, schools that I've attended, I've always been asked to be a part of the diversity committee because that's what we do to people of color. We give us all kind of other extra work to do. And I've done that. As I've risen in the ranks, though, I've realized that I have a voice that not everyone has. And so I've been very determined to use my voice to be able to speak out for people who don't always have that voice, and for people within the systems. And some of that, like in academia, some of that's nursing and hospital too, but it's not just nurses, because it's often the people who are the computer IT guy who comes to fix your computer and people forget they're there. Are the ward clerks or secretaries that people don't think about being there. So the CNAs on the unit. So it's just this idea for me of just that I have a voice. People are going to listen to what I say because I have titles and stuff behind my name. And so I need to use that voice to make sure that this perception is there and that people are told when they're crossing lines, and that and being able to speak up and advocate for others.
Great. Yeah, you grew up in the South. When I first came here to the States, I actually ended up in Florida. And it's a little bit different. But the funny thing was my driver's license said I was white. So that was a hoop. Anyway, but how about you, Minnie? Tell us about your background and how you came to think that there's racism is an issue in nursing.
I grew up in Yonkers, New York, just north of New York City. And in the early and mid 1980s, when I was growing up, there was a huge, Yonkers was the site of a big desegregation battle. And the city where I grew up was in a battle with the federal government about having purposefully segregated both its housing and its schools. And this wasn't just Yonkers, right? This, of course, had happened all over the country. Yonkers happened to be in a federal lawsuit about this. And so there was huge concentrations in neighborhoods of white people and Black people. And the areas where Black people live in Yonkers were generally where public housing was located. So I grew up in sort of steeped in this battle about race and came to see very early just sort of the rampant racism that existed in my community. And so when our schools were desegregated, because that's the first thing that happened, I went to high school and listened to teachers, say abhorrent things, horrible racist things all the time. People who were really, really resistant to seeing their neighborhoods change, to seeing the schools change, and for the whole city to be integrated. So I would say it was a radicalizing experience. It was an eye-opening experience that now I'm very, very grateful to have had at the age that I did, because it feels like something I've known for a long time. And so it doesn't make it, I don't want to say that doesn't make it, challenging, or that means it's sort of easy, or that I'm some kind of expert about it. I don't think that at all. I just think it's better to have known earlier. And so the question is, why racism? I mean, why nursing? Why racism in nursing? Well, racism is everywhere, right? And it's a foundational part of how we live in this country. Well, really in the whole entire world is built on racial hierarchy. So nursing is not excluded from that. So it's not really like, sort of a coming to, I guess, nursing is, there's racism in nursing practice. It's more that we have to contend and deal with this in everything that we do. And nursing is my profession and education is my profession. And so now this is a part of my practice as well.
Yeah, well, that's good. So back in the day when I first came here in the early 80s, 1979, whatever, used to work in Miami. And one of the, some of the white ladies there do not want a colored person taking care of them. So been through that. It basically improved towards, as the years went. And now I see it coming back. So, this is a good discussion to have. Right.
And I would say it never left. It's just, I think people feel more emboldened and empowered to say it. And so I know that oftentimes we talk about racism from, it's easy to think about it at an individual level, so people can talk about their own experiences and what happened to them. And at the individual level, it's harder. I mean, we can make change, but the problem that exists for us is that it really exists at a more societal level, like Minnie said. And so when I think about the story you just told, Jodi Picoult had a book, Small Great Things, and it was actually about a nurse on a labor and delivery unit whose patient came in, was a Klans person, KKK. They were in Connecticut. Said Yale New Haven was the hospital, but said he refused to have a Black nurse take care of him or his wife. And the wife ended up having the baby, and the nurse was able to stay away until something happened, which made her then, because as a nurse, you're obligated to take care of people and help people, but yet you have this mandate. And I think the part for me that's interesting is that when I talk to people a lot about that story, people always want to talk about the nurse and what would I have, especially white folks, want to talk about what would I have done if I were the nurse. And I'm always saying you don't have to really worry about the nurse, because a person of color in this country knows about discrimination. This wasn't her first time with that. What I often say to people, though, is what we need to be thinking about as nurses is what about the system that enabled that to happen? So when he went to the head nurse to say, or the nurse manager, whoever, to say, I don't want any Black people taking care of my family, who didn't say something? What about all the other nurses on the unit who knew this was a good nurse, who knew she could take good care of people? So same thing in the story that you told. I think that's where we see the institutionalization of it, because it's like in our society, we are very accepting of the fact that we can see minorities as less than, are inferior, not as smart, all those kind of stereotypes. And that's what that's the part where if we really want to make change, we have to make change at that level, at this higher place. And that's what most of the protesting is about, is making this structural level, system level change that will then lead us to where we want to go.
Okay, well, we'll discuss more about that. But earlier this month, and thank you for that, Dean Amar. Earlier this month, Governor Steve Sisolak joined a handful of states like Colorado, Ohio, and Wisconsin, and more than 20 cities to declare that racism is a public health crisis. So why is racism a public health crisis? And what does this declaration mean? And what do you think the outcome's going to be?
Do you want to go, public health nurse?
Sure, I'll start. First of all, I'm just glad. I'm glad to see this phrasing being used now, right? That racism is a public health crisis. We've for a long time have talked about health disparities or racial disparities, and there's a danger there, right? In somehow locating the problems with race itself and not with racism, right? Not seeing race as a social construction or race as a series of systems that enable certain conditions to happen, right? So why is racism a public health crisis? Well, there's, a cumulative set of inequalities that result in racial disparities pretty much all across the human lifespan, right? From much greater likelihood that Black mothers will die in childbirth, to Black people having a lower life expectancy, to unequal, disproportionate rates of various chronic diseases and other health problems. It's everywhere. Okay, this is everywhere. We see it all the time now with COVID, right? Especially with Black patients are, it seems like right now, more than twice as likely as white patients to die from COVID. And so these are not essentialist things that can be located in individual people. These are structural, systemic issues that have led, a series of cumulative factors that result in these outcomes. So it's different outcomes, across racial categories. So do you want to add to that, Dean Amar?
Yeah, the only thing I would add is that I think that it's easy to talk about all of these pieces and diseases and say, like even with COVID, where we say people of color are dying more, but we're also showing that when you look at the testing centers, where they're located, when you're looking at the treatment rationale. So I'm going to be told, go home and wait, or don't come in and take care of myself at home. Minnie's going to be told, come in right now, let's get all the treatment. And so the underlying piece of that really is that it isn't just about there's something inherently wrong with people of color. It's racist, and it's not racist at an individual level, but at a structural level. So if a Black man, two men walk into a clinic at the same time and they both have the same cardiac profile, if one of them is white and one of them is Black, the white one is going to get referred for all the testing, they're going to get the medicine, they're going to get all the pieces they need, and the Black one's not going to get that same standard of care. Two women show up breast cancer. The white woman, who could look like the physician's mother or grandmother, is going to get all the treatment. The Black woman is not going to get it. And that's racism within our system, because we've decided to make differences. Even things like when we think about the incentives barometer, we look at our lab values. We have all these different things that qualify. If the person is this race, this doesn't work. So the measuring tools aren't made for people of color. They're made to measure European ancestry or whatever kinds of things. And so when those things don't work as well, it's kind of like, oh, well, problem with them. But the problem isn't the people of color. It's that the system isn't set up to really treat the problems. And it's racism that's the cause, not
Yes.
the race of the person.
So
Yeah, and if-
you just mentioned a couple of interesting things which I was going to ask you about. So this is you made mention of some examples of what you call the institutional or systemic racism, correct? Can you sort of expound on that? Oh, I'm sorry, Minnie, did you want to say something else?
Well, it kind of leads into this too,
Yes.
because part of what I was going to say was that even the risk for COVID, right? Your occupation relates to that. And so we have disproportionately more Black people and other people of color who are in occupations that put them at risk for COVID, and that has to do with institutional and systemic racism. When you look at housing policy and how that relates to education policy and how ultimately that influences levels of education in different communities, ultimately wage and income, all of those things are interrelated, and they're related to hundreds of years of policy that brought us to where we are now.
Exactly. Kamara Jones, who was the president of the American Public Health Association, has been at CDC, was the president at Harvard for a while. She has this analogy she uses, the gardener's tale. And the gardener's tale talks about that if you had two garden boxes, and one had old soil with rocks and all kind of stuff in it, and the other has all this fresh potting soil and is rich and developed and the whole thing. And so if you planted pink geraniums in one and red geraniums in the other, well, then certainly the first round of that is not going to look the same, because the one that has more sand in the soil and rocks and dead roots and all these things, they're not going to grow to be as pretty. And if we went through multiple seasons where we still had this same soil that isn't getting the nutrients, all the things that it needs, but this other one box who's in prime position, you're going to continue to see that red geraniums are beautiful and big and full, and pink geraniums are kind of straggly. And it's easy to say there must be a problem with pink geraniums. I don't like pink geraniums. They don't grow well. Versus saying there's something wrong with the box, with the environment, with how we're growing it. And that's sort of that analogy of systemic racism, because if you think about generations of time where people were held where you couldn't, you think about, even if we could start with slavery, but even if we didn't, we can come beyond just to say that even from post-Civil War, where people still didn't get a fair wage, where housing, you couldn't live in the same neighborhood, schools, the whole separate but equal doctrine. So you didn't get books for your schools. You couldn't go to the same place, couldn't drink from a water fountain when you're out in public, couldn't own property, couldn't vote. Today we're celebrating women's right to vote. Well, that was white women's right to vote. Not every woman could vote. And so it's all those things that's Minnie was alluding to, that across time embed this in our system. So it's real easy to just have this, we hate pink geraniums, they're no good. We love red geraniums, but that's not really addressing the core issues, because the core issues have to do with the generations of soil that was deprived and that didn't get what it needed, not an inferiority in the seeds or the colors of the plant.
Right. That's a wonderful analogy, actually. I got to get that book.
There's a good
article.
There was a TED Talk, I think, that you shared. Somebody shared.
There's a video. Her video is about the restaurant one, because she kind of took it to the next level.
Oh, yeah.
Gardener's Tale. I think she came up with that like in the 80s or something. It isn't. I don't know where that was a brilliant idea, but it works really well. Kamara Jones.
Yeah. And it really, you kind of segue to the next question I was going to ask you, Dean Amar. some of the social deterrents of health are economic stability, neighborhood, physical environment, and education and food, and of course the availability of the healthcare system. So how and can you explain a little bit more on how the social determinants of health lead to racism?
I mean, this race is a social determinant of health. I mean, we don't want to always put that in there, but race is a social determinant of health. It's also astonishing to me that these same things affect education as well. And so I think what we're talking about is who has privilege and who doesn't. And so if I get to live, I mean, at one time, the reason that you find so many minorities in, like even in the city, and especially like waterfronts, historical, because the waterfront had all the rats and all the others. So historically, you've put people in neighborhoods that weren't as nice. And so those neighborhoods, the cities, the white flight, so everyone left the city, we're in the city until everybody wants to come back. I mean, all of the housing discrimination, the job discrimination, healthcare discrimination for decades. We had hospitals only admitted whites. You had to have a black hospital, or you had separate wards or units, with one was well stocked with supplies like the red geranium box and the other wasn't. And so all of those things contribute to what we call social determinants of health, because there are all these other features that affect health. And Minnie's going to probably say it better than me because she's the public health nurse. But it is that whole thing of, yes, I'm going to be affected by where I live, the income, all these pieces, but race is also a social determinant.
Yes.
Yeah.
Because race is socially constructed.
Thank you for that. Okay, Minnie, you stated in an article that was featured in Las Vegas Heals that you chose to ground your nursing practice in federally qualified health centers created to care for the underserved people, quote unquote. Okay. How did you come to that decision of serving these people, and how does that play in preventing or maybe raising awareness of racism?
I'll start by saying, I guess I came to that decision because I believe in the mission of federally qualified health centers. So this is, federally qualified health centers were created. They're also called community health centers. They were developed in the 60s as part of the war on poverty during the Johnson administration, and the idea was to serve people who are underserved, right? Who, generally don't have the same access to healthcare, who may be uninsured or underinsured, or because of where they live or, who they are, not necessarily, they just don't have the same access to care. The other thing that I love about federally qualified health centers, they have a philosophy that sort of comes out of the civil rights movement, this idea of participatory democracy, where you have on the board of community health centers patients, people who are served by that clinic or health center have to be on the board too. So most health center patients are people of color. Most health center patients are low income or poor. And I'm just not a person who wants to work in a for-profit healthcare environment. I'm not really interested. So, I want to be in a place that's, mission driven. And that's why FQHCs exist. If we had a more equitable society, there wouldn't be a need for federally qualified health centers. They're there to fill the gaps, in, where the places that our care doesn't reach, so.
Yeah. That's great. That's wonderful. Applaud you for that.
Thanks. I need to sleep at night. I'm one of those people. Yeah.
Yeah. Different. If you look at the acute care and the community health, they're two different totally systems.
Well, I don't think they are. I mean, part of what I do when I'm teaching community health, especially to nursing students when they're getting educated, is to try to see the connections between what's happening in acute care and what's happening out in the community.
Yeah.
I see. Go ahead, Angela. I know you want to say something. Do you want to say something?
Well, I was just going to say, it's just what you said. I think that it's
Yeah.
important. Where I came from, we used to do things where the students had more ambulatory care, clinical, but they also had opportunity to sort of follow patients and think about hospital home. And I think that I'm always saying to students that patients know when we send students in to do discharge teaching, as opposed to NCLEX would tell us we send the most experienced person because it's a chance to teach them, to make sure they understand, to make sure they get it. We send students in, and when the student goes in to do the teaching at discharge, the patient knows right then and there what they're going to do and what they're not going to do. They listen, they nod, they go home. And so we view the revolving door kind of piece of it. If we were to follow people and really think about what does home look like, what's going on, we could better partner with them to talk about how we could transition their care to ways that would work for them, as opposed to just existing in this system that acts as if they're two separate things. And inpatient is full of those non-compliant people who don't do what we ask, revolving door. And outside of the hospital is full of how do we empower, how do we help? But by the time you get to them, there's so much already there that it doesn't give the opportunity. So, I mean, I think there's lots more we could do to pull those two together, because most of people's health happens outside of a hospital.
Exactly.
And what I meant when I said it was two totally different systems is one thinks that they're more superior than the other. If you were in the community health or if you were in home health, you didn't know much. So
psych.
And also one hand may not know what the other hand is doing, right? Or we're not very integrated in that way. And so, nurses who are in acute care having a greater awareness of what's happening in the community, and not only greater awareness, but being advocates, for policies that impact their community and will improve situations for patients in acute care is important. So it's important, both ways, in both directions.
Cool. Well, thank you. Okay, so in follow-up to the earlier question, the discussion we had, in 2019, the Nursing Times, and this was in Britain, I guess, reported that there has been a high level of racial discrimination faced by nurses. And they did a survey, and nurses had reported experiencing discrimination in the workplace from either a patient or a relative, or they experience racist behavior by staff members, managers, and the leadership. So have you experienced that in your career, and how do you suggest nurses deal with these situations?
So short answer, yes, of course. And I would say I still do now. I'll go places with my associate deans and people always want to make them the dean and me probably their secretary who's there with them. And so I've had that a number of times. As a nurse, I've had that where it's easy for people to think that you're someone else and that you're the help, you're the cleaner, you're the assistant, you're the whatever. I mean, and I think the solution though is really for nurses who have the privilege to really intervene and help. I think the allies are needed. I think that oftentimes when we talk about race stuff within nursing, but within society as well, I often say that people want to hear me tell a story so they can say, oh my God, that's so terrible, horrible. I would never do that. I'm so sorry that happened. And that changes nothing. And I'd rather hear, this sounds awful, I'd rather hear Minnie talking uncomfortably about the privilege that she experiences and what that means for her, and the disconnect if Minnie and I walk in and people say, hi, you must be the dean and I must be the instructor. Because I think that's where change happens. And I think allies have to speak up, and people have to say that is wrong. I have a friend who's a flight attendant, and she was talking about the people getting off a plane, and this older white gentleman talking to this Black man who was older than him and saying, come on, boy, move along. And she turned and said, he's older than you. You need to show him respect. If you think you're going to get off this plane with being disrespectful, I stand between you. And I think more of that kind of thing needs to happen, because I don't think that people are always aware, and I don't think the onus should always be on people of color to try to start the conversation and make the conversation happen, push through. I think it's a total team effort, and that people need to be, I think leaders need to be always searching and thinking about the ways that disparity and inequity exist within their systems. And anybody who says it doesn't, they're lying, because it does. It exists in every system, and we need to be looking for the ways that we can correct that we can intervene, that we can hold people accountable for it.
Right. And that is so true. That's so true. How about you, Minnie? You have anything to say about that?
Well, I'll piggyback on the part, like, as a white woman, no, I have not had experienced racial discrimination in the workplace. I've certainly been, witness to plenty of it. And I think that, what Dean Amar is saying about allyship is the part that I can, relate to. I've been in a lot of situations where I have felt the need to intervene. Patients who were being inappropriate, making racist remarks. I would just say you have to be willing to be uncomfortable. It's uncomfortable and it's hard. I'm not going to, pretend like I've arrived at some place that this, that it's easy to do, and as my heart still races a bit, and I still get nervous when I have to go and try to be, to say the difficult things, or the things that I perceive as difficult because of my privilege, right? So yes, in the clinic environment, in hospital environment, not with students, I don't think, yes, even in education environment, there have been plenty of opportunities to have to, sort of intervene and I guess call things out, right? Call them to the surface.
Exactly. The other thing I think that makes it difficult too, Doris, is that we've sort of set racism, bigotry, prejudice, all of these things as a dichotomous sort of thing. You either are or you aren't.
Right.
And that's never true for anything. And so we don't have this, we aren't accepting then of a range of behaviors. And so there's one thing, there's someone who told me recently about someone at UNLV who right before Mississippi outlawed the flag, that they had to buy one because they just had to have one. And I would call that a racist act more than I would say the person is racist. But somehow if you say to someone what you just did could be construed as racism, that's about as non-threatening, I think, as I can say it. But the person still hears, are you calling me a racist? I'm not racist. I have Black friends, and they go through all this stuff. And I'm often saying, I wish it could be like, kind of like if I tell you you have spinach in your teeth, you don't say, are you saying I have poor dental hygiene? Do you think I don't floss? Do you say I don't brush my teeth? You just say, thank you. Thank you. And you go run to the mirror and you get the spinach out. And I think that we need to have that mindset of we all can end up saying things that can be perceived as offensive by someone, and that can be perceived as just not aware. People say and do things all the time based on a level of what your frame and what you know, and being open to be able to have someone say that could have been a racist act, or that was a racist act, or I perceive that as racist against me. Having a person say, let's talk more about that. Tell me how you feel about that. Tell me what you think about that. Let me learn from you more than this. No, it isn't. No, I didn't. That's not what I meant. And it doesn't, intention's the other one, because if you hit somebody, it doesn't matter if you intended to hit them or not, you hit them and they're hurt. And so you have to deal with that. And I think those are the things that complicate this, because people get so stuck in this, I didn't do it, I'm not a racist, I didn't mean it, that you can't have any conversation to learn from. And learning is the only way we're going to change this.
And that's, that's one of the ways that, the discussion about structural and systemic racism, acknowledges that we're all in the same stew. Like we were raised in the same stew. There's no, some people aren't outside of it. Like it's not just like, it's not good or bad people. It's about, a way of thinking that's ingrained, and some of it is very automatic. So I really appreciate the way you framed that, Dean Amar.
Yes.
Yeah.
So while we're at the topic, what is your opinion on what's currently fueling the rise of racism? I know within, against Black people and Asian people. I know we've had this. Just want your opinion on that, if you have one. Very difficult
to say
question,
the same thing.
We're probably
not difficult at all. I think that our leader is full of divisiveness, and I think that it's always been there. But the era of political correctness, where people weren't going to just say offensive things, has gone away. That's one of the things he's pretty anti about. We have to just say what we think, and I think. Prior to the 50s, there was a lot of political correctness. It just wasn't going to benefit me at that point, where now it might have. But I think that our leader has made it, has kind of stoked racial tensions, has made it clear that that's what his platform is, the way he's going. The China virus, I mean, does he have to continually say that over and over and over? Does he have to praise white supremacists at all? But he does. And so I think that he's just made it where people feel safe to say the things that they couldn't say before.
Agreed. There's permission there, right? Where there wasn't before, because it's modeled, by the President of the United States, so there's good people on both sides in Charlottesville, right? There are rapists and murderers coming across our border. And the sort of all the racist rhetoric around the coronavirus that Angela was just talking about, it's top. I don't believe it's top down, in that I think it is all there. And I think that he is more of a mirror and a reflection of a lot of hidden, stuff that we keep under the surface. But certainly the bringing it out into public with very little repercussion or consequence, from supporters has certainly made it. I think the word is, I don't know if you used the word or it was in my head, emboldened, right? Just this, stoking.
Exactly.
You're right. And perhaps this is another podcast in itself, from opinions, but from our healthcare workers. But we'll see. But thank you for that. I do appreciate it, because we do feel it. I'm Asian, and Filipino American, and so we see this all the time. We do see it. So okay, so how can nurses make a difference then? What is the one thing, or what is something that you wish nurses knew and did about this?
So I have two kind of, and it's the things I wrote about in that article, because I do believe that nurses like to talk about not seeing color, and nurses like to talk about treating everyone the same. And both of those are not the correct approach, because they deny the individuality of people. They don't allow us to treat people holistically. And I think that it's more that people don't want to have the tough conversations. So if you say, I don't see color, then I'm not a racist. And I don't see color is kind of scary, because people say, I don't care if blue, black, green, purple people walk in. And I'm thinking, well, if purple or pink people walked in right now, I'd be a little nervous, just for the record, because that's not normal. And so there is something about, as nurses, if we're going to fight racism, we have to see race, and we have to recognize that there are differences. When you look at our curriculum within nursing, a lot of it does come from a very white as heteronormative, as normative. White heteronormative.
Well, that's heteronormative too.
It is. Right. It is true. It is true. But what we talk about as normal, what we talk about as skin color, all these things usually come from this sort of white lens, which makes sense in this country, because for the longest most nurses were, and we weren't allowed into the conversation.
Right.
But I think that has to change. And I think that people have to be able to have those conversations and see the race, see the color that exists. And people also have to recognize that you do have to treat people differently. That treating everybody the same is not the answer. That means you're not giving people the care they need. So I always say we don't give blind people pamphlets because it would be ineffective for them. And so by the same token, you can't treat all of your patients the same. You give people what they need from you, not what you gave every other patient, because that doesn't benefit them. And I think nurses default on those two things. I can't be racist. I don't see color. I can't be racist. I treat everyone the same. And to me, on some level, both of those could make you more racist because you're ignoring something that's sitting right before you and exist.
Right, right. Minnie, do you have anything to add to that?
Yeah, there's always so much to say. I have at least two as well, but I mean, I think they're all similar. I started off just thinking about, probably the most personal part, which is this like kind of idea of decolonizing your own mind, like, right, trying to learn and understand what you see and what you don't see because of your own perspective, right? That you may have, a racialized perspective as a white person that, has all of this privileged narrative, and doesn't see different things. So we have to start with, reading, learning, listening. There's tons of stuff out there to educate ourselves. And so there's got to be a willingness to be uncomfortable, right? To have conversations. I think it takes practice. We have to practice. Like, we're not just going to automatically be able to go out and, start educating our students. We have to educate ourselves as well. And then, you mentioned one thing that you wish people would know or focus on, other nurses. I have a real pet peeve, right, about like the idea about individual behaviors, right? Like these non-compliant patients, as if we're divorced from the context in which we are, drives me crazy, like that. We have to not only be willing to see the way systems work and the way populations function, but know that the best bang for our buck and the way that we're going to be most effective is when we change policies and things that affect huge numbers of people, right? Not one non-adherent patient, who returns to the ER every week. So that's one of the things I really wish we could switch focus around. And that, of course, that relates to anti-racist nursing practice, right? Is, not just being focused on one individual, but being focused on systems. So.
Yeah. So what, you both are educators. What needs to change in nursing education? What would you be doing at UNLV to try to turn this around or help, the nursing profession with racism?
One thing I always like to say about UNLV is that I think UNLV is doing its part to change sort of that national narrative. When you look at the nursing literature and it talks about who's unsuccessful, who are at-risk students, the list always has students of color, first-generation college students, economically disadvantaged, educationally disadvantaged. When you look at our UNLV student, English as a second language is the other thing. That's our UNLV student body, and our student body's doing well. And in many places across the country, those are the students who are having trouble in institutions. So UNLV is doing something very right and very well, because we don't look like the typical nursing school. So overall, I think UNLV needs to be sharing the stories and the how and the what's are we doing that makes this different for us, that why are students thriving and doing really well here that aren't able to do as well at other institutions. And I think that would be I keep saying we need to publish and put out all these stories because I think we're doing a good thing. Overall, I think nursing education needs I call it a recentering of education. And so if you think about the fact that when you look at most nurses and most nurse educators, I think the average age is 50, it's white, it's middle class, it's heterosexual, all those things are what we see. And so when you look at our curricula, when you look at our textbooks are all written from a white lens. We put little text boxes that have lots of stereotypical information there. We don't always teach about that and have conversation for students to question assumptions. We kind of lead with assumptions, and we kind of let the conversation go wherever it goes, or the readings, and our students are waking up to that. They want more. They're challenging the books. They're challenging the things that we do, which I think is wonderful. Great. I keep saying I'm excited for this next generation to take over and lead. But I think nursing has to think about this recentering, that we're not serving just for middle class white heterosexual women. We've got a bigger society that looks very differently, and that's who we need to be educating our students to take care of, and that's who needs to be in our student bodies and on our faculty.
Great, good.
Yeah.
Minnie,
yeah, those are,
or anything? No.
Yeah, I would just add, and those are issues of representation, right? Representation is important. That our nursing student body reflect our communities, that the people who are teaching our students, reflect them. Students do better too, in those situations, that our nursing leaders, right? That there's a wide representation of our community. But I would add also that we tend to teach about, so first of all, I don't think we teach about racism really much at all, if ever. If we do, it might be within the confines of a population health or community health nursing course. And even then, it might be within a discussion of the social determinants of health. Even then, usually we'd rather talk about the social determinants of health in general than talk about racism, right? So I think we have to be willing, number one, to bring racism into the conversation, into nursing and healthcare, right? And talk about what the impact of it is. And also, number one, believe that it's important, and that it is incumbent upon us to do so. But I'd also always love to see more of this discussion threaded throughout our curriculum, right? That it's not just confined to one course in one semester, but that, it's something that is happening throughout our levels and throughout our different courses. There's no reason why we wouldn't be discussing the impact of race or racism in a medical surgical nursing course. Of course we should be.
Yeah. That's true. Okay, so the one other question I wanted to ask you is, about our leaders, our nursing leaders. I know when I first got when I was a new manager in the home infusion division, I had a patient who called me. He was white, and I had sent a black nurse in there to take care of him. I get this call, and he says, I really don't want you to send back, that nurse, because my dog is afraid of black people. And I'm like, you little turkey. I said, you might as well have told me that you don't like black people. And to think of it back then, I did not really know how to respond to that. But what I was thinking was, if you only knew what I looked like and who I was, that I'm also a person of color, on the other side of the phone. So I had to learn, and I'm still learning on how to deal with that. Of course, I had to send a different nurse to that person. But what do you think nursing leaders can do to promote anti-racism in nursing?
You want to go?
I'm going to start with our nursing leader. You're my nursing leader.
Okay. I think that everything starts from the top. I think that I say all the time that nurses are really good problem solvers. And so if this was a problem that we wanted to solve in nursing, we would have solved it already. And so there's some resistance to solving this problem, to looking at this problem. And so I think that leaders have to, from the top, say to people, we are not going to tolerate any, and you can define a whole big range of behaviors that are not going to be tolerated and not going to be accepted. And then you have to live it. You have to call it out when you see it. You have to correct it when you see it. You've got to put consequences of some sort when you see it. I mean, we've really got to live. And I think at a higher level too, we've got to hold people accountable. And so the same thing, I think if nursing wanted to solve this problem, we would have. We would have made sure that our curriculums were anti-racist. We would be admitting more students of color. We would have more faculty of color. We would do all these things. So I think leaders have to model that behavior, and leaders have to set a structure. And then you have to be pretty fearless in really scanning for where are the things that are problematic, what matters to different people. And I think the other thing I would say is that this also being aware that most of the time this stuff comes in this form of microaggression. So depending on how this nurse learned from what happened and whatever, there could be a part that just always wonders, did I did something wrong? Was there something I didn't do? Or maybe she knows that it was because he didn't like her color or whatever. And I think that those things feel like the paper cuts, but it's sort of the death by 1,000 paper cuts, because there's paper cuts over and over and over and over and over and over. And so I think leaders do have to figure out where are the problem areas in my system, where are the things that things fall apart, and how do we fix those things? How do we empower people to call out behaviors? And it comes from you calling out the behaviors and you saying, this is not the way we roll. This is not the kind of agency. That could sound like a racist statement. And that's not behavior we tolerate within our institution.
Yeah. Big learning curve there. Okay, Minnie, if you want to add to that.
I think we need to own our sort of power as advocates. Part of the definition, the definition of nursing practice includes, a social justice imperative, right? And advocacy. And so I just think in the sort of policy, like all public policy is healthcare policy. All public policy is health policy. And so just sort of getting involved in what's going on. So there's always this hearts and minds part, right? That's important, really important. But at the same time, if you think of, we didn't wait for the Voting Rights Act or for the Civil Rights Act to convince everybody that was, the right thing, the next thing to do too. We worked on just changing policies and ask everybody else to catch up, right? And so what are the things that are going to help equalize, the playing field? Big sweeping policies that have to do with housing, healthcare, anti-poverty, transportation, those kinds of things. And this is not to separate, this is to be paired with the kinds of things that Dean Amar is talking about. I think it's a both and, we need all this stuff happening at the same time.
I agree. The policy, the legal implication kind of pieces are powerful and need to happen.
Right. Well, I know this discussion can go on, and we might have to do a second podcast on this. But the last thing I'd like to ask you is, what is your message to our nurses and maybe the public about racism, dealing with racism, and how we can improve it, perhaps?
So I'll say that I think that what people don't always realize is that because of what we see in people, which isn't always who people are, but what we see in people, we draw conclusions, and we make assumptions based on what we see. So things like, black man, scary, things like Asian, model minority, there's all these pieces of things that we jump to just because of the appearance of someone. And what I would say to people is that I think that what's important for people to do is to be aware of that and to recognize that. And as you recognize that, to be able to challenge yourself, sort of say, what are my assumptions? I think this person is whatever. What are my assumptions? What are the things that I'm drawing from? And if they're things that really aren't about that person in particular, but more about because society's told me to be afraid of black men, or to worry about Latino women and their fiery tempers, whatever, then I need to stop, because that's not what this person's giving me. And I need to tune into this person in front of me and think about, is there another explanation? We often think people are going to act like us and do the same. So when people act differently from us, there's something wrong with them. And it really isn't. It's just that their lens is not the same as ours. So I think in so much of what occurs that is racist is because people jump to a conclusion based on just what they're seeing in front of them, without any data to support it from that person, without any other thing. And if people could just start to realize that and check their assumptions and validate their assumptions and act in the way that is reality versus just what's in the back of their head because society's told us certain things about certain people, that would be helpful.
Well, thank you, Dean Amar. And Minnie, your message?
I guess my message would be that, there's no time for denial anymore, right? Like, it's time, it's time to be a listener, and so when, after George Floyd was killed and there are hundreds of thousands of people all over the country, right, coming out in historic numbers, demanding to be heard, like it's time to listen, and say, if I don't know or if I'm not aware, like the only thing in the way of that is me, right? The information is out there. The filling in the gaps of what you didn't learn in school, because you didn't learn it all, right? You didn't. It's all out there, and it's incumbent, upon us to do that. I think I said this a little bit before. I used this phrase, but I heard a podcast fairly recently with Ta-Nehisi Coates, who said, "Catch up. It's time to catch up. If you're behind, get yourself caught up, because we're moving forward now." So, I guess I think that's it.
Yes, thank you for that. I'm one of those people who needs to catch up, to catch you guys up. But anyways, I'd like to thank you both, Dean Angela Amar and Miss Minnie Wood, for coming to our podcast, and today to Filipinars. And this is a very interesting topic, and I believe you both have tackled it very successfully. And for those of you who are listening, if you want to see more of Dean Amar and Minnie Wood for more discussions, please put that in your comments. Give us a call or write us, and we'd be happy to have them back. But really, we thank you for your time and your expertise in these matters, and the work you do to change the nursing curriculum to move towards an anti-racist nursing practice at UNLV is extremely commendable, and will benefit many practitioners in the years to come. So our thank you again.
Thank you so much.
Thank you. Thanks for having us.
Okay, well, and to our nurses, I'd like to say that the American Nurses Association has a position paper in the nurses' role in addressing discrimination, and this can be found on their website. And in part, the summary of the position paper states, and I quote, "Discriminatory practices are either intentional or unintentional, and must be addressed by individual nurses and the profession as a whole. Health disparities continue to exist and are influenced by health policies, individual discriminatory actions. The nursing profession is responsible for promoting an environment of inclusiveness and where people will receive safe, quality care, and caregivers are intolerant of any discriminatory practice," end quote. And to our listeners, we leave you with this. Race is one of the most difficult topics of discussion here in our society. Like Minnie said, catch up. The key to bringing about change is to understand each other and understand each other's story. Thank you very much for tuning in. This is Doris Bauer, your Filipinars host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you Filipinars, news and features about the Filipino American nursing community and beyond. Fridays, 7 p.m. on PHLV Radio.